Opening with a question, have you ever pondered the route of a private assessment for autism spectrum condition in the UK? This query opens up a world of considerations and benefits that could be pivotal in making this important decision. On the sunny side of the street, private assessments for autism spectrum condition, or ASC as it's commonly known, can offer some distinct advantages. The first being faster access. Unlike the potentially long waiting lists that often accompany the NHS services, private assessments can offer a quicker path to evaluation. Another benefit lies in the realm of flexibility. Private assessments can offer you more control over the scheduling of appointments and the choice of assessment providers. This can be a game changer for those juggling busy schedules or living in more remote areas. Private assessments also offer the possibility of a more comprehensive assessment. These assessments often involve a team of professionals who specialize in diagnosing ASC, providing a potentially more thorough evaluation than what might be available through NHS services. Moreover, private assessments can give you access to specialist services. These might include specific diagnostic tools or therapy options that are not readily available through the NHS. But like any path, there are stones that might make the journey less smooth. The first consideration is cost. Private assessments can come with a hefty price tag. The costs can vary depending on the provider and the extent of the evaluation. It's crucial to consider whether this financial investment is feasible for you or your family. Another consideration is the acceptance of the private assessment by the NHS or educational institutions. While private assessments can provide valuable insights, there's no guarantee that these institutions will accept the diagnosis without further evaluation. It's crucial to discuss the implications of a private assessment with the relevant stakeholders, such as schools or healthcare professionals. Coordination of care is another critical consideration. If you choose to go the private route, it's important to maintain communication with NHS services and educational institutions to ensure continuity of care and appropriate support following the assessment. Lastly, when choosing a private assessment provider, it's essential to ensure that the professionals involved are appropriately qualified, accredited, and experienced in diagnosing ASC. Look for providers who adhere to best practices and ethical guidelines. In the grand scheme of things, the decision to pursue a private assessment for ASC is a deeply personal one, influenced by individual circumstances, including specific needs, preferences, and resources. It's a balancing act, weighing the potential benefits and considerations carefully. And remember, it's always a good idea to seek guidance from healthcare professionals or advocacy organizations if needed. This journey is yours, and every step counts.